Hello everybody, the purpose of this video will be to facilitate your first contact with the microscopy of blood and encourage you to use other resources. So we know that the blood is a suspension. It's a suspension of foreign blood elements within a liquid part which is called plasma. The mass of blood ranges between 6 to 9% of the body weight. Depending on age and hydration of the body, and as the quantities will be expressed in various volume units, let us remind that 1 liter equals 1000 milliliters, which is 1 million 10 power 6, 1 million microliters, and 1 microliter equals 1 cubic millimeters. So you'll always be able to understand your results depending on which units will be used in your lab. The pH of the level is very strictly kept between 7.36 to 7.44 with the average value of 7.40. So first we have the blood plasma, that's the liquid part. Often abbreviated in the results as P if some biochemical results are calculated per whole blood plasma. It takes approximately 55% of the volume of the full blood, and it could be further separated into serum and fibrinogen plus other clotting factors by coagulation. So if you let the plasma coagulate, the liquid part that remains would be the serum, often abbreviated as S, but it will be without these clotting factors consumed during coagulation. And then we go with the foreign blood elements. They are responsible for approximately 45% of the volume of the full blood, and this value is also called hematocrit. So which are these blood elements? Let's discuss first the erythrocytes, also called red blood cells, abbreviated as RBC. The normal values slightly differ in male and female. In male it's 4.0 to 5.8 millions, so 10 power 6 per cubic millimeter. In female it's 3.8 to 5.2 millions per cubic millimeter. Now all these reference values could vary in various labs, so when you're working as doctors, make sure to consult your lab which reference values are valid for your lab and for your population of your patients. But it will roughly oscillate around these values. Then we got thrombocytes, also known as the blood platelets. The normal thrombocyte count ranges between 150,000 to 400,000 per cubic millimeter. Okay, and then we have the leukocytes, also known as the white blood cells, WBC, and the total leukocyte count ranges between 4,000 and 10,000 white blood cells per cubic millimeter. The leukocytes are further classified into two major groups: granulocytes and agranulocytes. Depending on whether the cells do contain or do not contain so-called specific granules. We have three types of granulocytes, the most common being the neutrophilic granulocytes. And if you take all leukocytes as 100% or white blood cells, then the neutrophils will be responsible for 50 to 70% of all white blood cells. So these are the most numerous leukocytes. Next are the eosinophils or eosinophilic granulocytes, significantly less frequent, 0 to 5% of white blood cells, and basophils, basophilic granulocytes, 0 to 2% of all white blood cells. And here we go with the agranulocytes, which are lymphocytes, with 20 to 45% of white blood cells. So these are second most common white blood cells in the peripheral blood. And the most common classification is into T lymphocytes, B lymphocytes, and natural killer cells. So T lymphocytes have complicated classification, so we can simplify it mentioning the major types, namely the T cytotoxic, abbreviated as TC, T helpers, TH, and T regulatory. Treg, previously also called T suppressors. Then we have the B lymphocytes. We have met these cells before because we know that they can, once activated, they can migrate into tissues where they differentiate into plasma cells of connective tissue that are producing immunoglobulins, okay, antibodies, and natural killer cells. The other major category of agranulocytes are monocytes, and that's like 2 to 10% of white blood cells. These monocytes can also leave the circulation, enter the tissues where they differentiate into tissue macrophages.